To all the pregnant and expecting mothers, I prophesy God's blessing upon you and your baby. Amen. Hi everyone. Have you ever searched for safe medicines to take for you and your baby during pregnancy? Or have you ever told your doctor or health provider to be careful as to the medicine to give you because you're pregnant? If so, I would love you to watch this video till the end because I'm going to give you 5 important medications that are safe and good for your baby during pregnancy, and also the ones that you shouldn't go near. Most medicines we use do cross the blood-brain barrier, and this may have negative effects to the baby, while others don't have, and so others just have little effects on the baby. Some medications can cause deformation to your baby. It is always advisable to go to your health provider or your doctor to have better advice on the right medication for you to use. Now let's move on to some medications that are good for you. 1. Over-the-counter drugs. Over-the-counter drugs are drugs that we take without doctor's prescription, and this is not good for the body. You know, most of these over-the-counter medications we take comes in combination, and these combinations you don't know the active ingredient and the other ingredient, so it has a high tendency of affecting the baby and also the mother's health. The only allowed over-the-counter medicine during pregnancy is the acetaminophen, which we know as paracetamol. Let's go to the second one. Analgesics. Analgesics are non-steroidal anti-inflammatory drugs. These drugs are not good for your body. Examples of such are ibuprofen, the Diclofenac, pyrantrin, and so on, but to mention a few. Analgesics should totally be avoided, especially after 30 weeks of pregnancy. They have the tendency to affect the baby and cause miscarriage. And I know you wouldn't harm your baby, and you wouldn't also want a miscarriage. Let's move on to the third drug, antihistamines. These are drugs that we take for allergic reactions, fever, and so on. A couple of such are the loratidine, cyproheptadine. These drugs should be taken with caution, and that is so because they have the tendency to cause sedation as side effects. The less sedating ones like loratidine can be used safely because they have no effects on the baby. Or the sedative ones like cyproheptadine should be avoided in pregnancy unless the benefits outweigh the risks, and also if your doctor or your health provider said you should take it, you are good to go. Okay, let's go to the fourth ones. Pregnant women always like to feel that they have warmth in their stomach. It is fine. Today, I'm going to show you the right warm medicine or warm repellent to take. Repellents like the palmoate is very safe in pregnancy. No effect on the baby and no effect on you, but has effects on that worm that is disturbing your body. Mebendazole, which is also worm repellent, cannot be taken at the early stage of pregnancy. It can be taken at the second trimester on. Now to the antidiarrhea. You know why pregnancy there is always high risk of diarrhea, and we have antidiarrheal drugs. Example is the loperamide. Also, we have the oral rehydration salt and the zinc that we use in the management of diarrhea. Most cases of diarrhea are short-lived, so as a pregnant woman, do well to take only oral rehydrated salt or therapy during pregnancy for electrolyte replacement, so you don't feel tired and weak as a result of excess passage of watery stool. Loperamide can be used in the second and third trimester, but in the first trimester, totally avoid anything to do with loperamide for that diarrhea. No to antibiotics for diarrhea. You don't need that tetracycline for diarrhea. That tetracycline can give your baby permanent deformation even after birth. If the diarrhea you heard is profuse, watery, bloody, please kindly visit your health provider or the doctor to give you better medications at the stage of your pregnancy. Thanks for staying tuned till the end. I am Pharmacist God's Gift, also known as the Pharmacist with the Difference. I am a practicing community pharmacist, and on this channel, I talk everything on health, prevalent diseases, sex education, immunity, and I also give top information on drugs to use for minor ailments. If this is your first time on my channel, welcome. And if you are a returning viewer, please keep coming back for more interesting and educative videos. Please do well to like, share, comment, subscribe, and ring that notification bell. Thank you.